With the rising prevalence of type 2 diabetes, it's not surprising that there are multiple treatment options available. Among them, Trulicity and Bydureon have emerged as two popular contenders in the race to achieve glycemic stability. But which one is truly the path to better blood sugar control? Trulicity, a once-weekly injectable medication, has gained the spotlight due to its convenience and effectiveness in reducing A1C levels. On the other hand, Bydureon offers a once-weekly injection that provides sustained blood sugar control. When comparing Trulicity and Bydureon, it's important to consider several factors, including their mechanisms of action, potential side effects, and overall patient satisfaction. Each medication has unique strengths and limitations, making it essential for individuals with type 2 diabetes to understand which option aligns best with their specific needs. In this comprehensive comparison, we will delve into the key differences between Trulicity and Bydureon, shedding light on their efficacy, safety profiles, and real-world patient experiences. By exploring the evidence-based advantages and drawbacks of these treatments, you'll gain a deeper understanding of which path may lead to glycemic stability and enhanced quality of life. Understanding type 2 diabetes. Type 2 diabetes is a chronic condition characterized by high blood sugar levels resulting from the body's inability to properly use insulin or produce enough insulin. It is a progressive disease that requires ongoing management to prevent complications such as heart disease, kidney damage, and nerve damage. The mainstay of treatment for type 2 diabetes includes lifestyle modifications, such as a healthy diet, regular exercise, and weight loss. However, medication is often necessary to achieve and maintain glycemic control. Trulicity and Bydureon are two medications that are frequently prescribed to individuals with type 2 diabetes who require additional support in managing their blood sugar levels. Overview of Trulicity and Bydureon. Trulicity and Bydureon belong to a class of medications known as glucagon-like peptide-1 receptor agonists, GLP-1-RAS. These drugs work by mimicking the action of the hormone GLP-1, which helps regulate blood sugar levels by increasing insulin secretion, slowing down digestion, and reducing appetite. Trulicity, also known by its generic name dulaglutide, is administered as a once-weekly subcutaneous injection. It has been shown to effectively lower A1C levels, with clinical trials demonstrating a reduction of up to 1.5% in A1C levels compared to placebo. Trulicity also has the added benefit of promoting weight loss, making it an attractive option for individuals who struggle with obesity. Bydureon, or exenatide extended release, is another once-weekly injectable medication that provides sustained blood sugar control. It works by slowly releasing the active ingredient over time, allowing for prolonged efficacy. Bydureon has been shown to reduce A1C levels by up to 1.6% in clinical trials, demonstrating its effectiveness in managing blood sugar levels. Mechanism of action: how Trulicity and Bydureon work. Trulicity and Bydureon share a similar mechanism of action as GLP-1-RAs, but they differ in their specific formulations and delivery methods. Trulicity contains dulaglutide, a synthetic version of GLP-1, which is linked to a molecule called FC. This linkage allows for slower absorption and a longer duration of action, resulting in once-weekly dosing. Bydureon, on the other hand, utilizes exenatide, a synthetic version of exendin-4, a hormone found in the saliva of the Gila monster lizard. It is formulated with microspheres that slowly release the medication over time, providing continuous blood sugar control for up to a week. Both medications work by stimulating insulin secretion from the pancreas in response to elevated blood sugar levels. They also inhibit glucagon secretion, a hormone that raises blood sugar levels. Additionally, Trulicity and Bydureon slow down gastric emptying, which helps regulate post-meal blood sugar spikes. These combined actions contribute to improved glycemic control in individuals with type 2 diabetes. Efficacy and clinical trials: a comparison of Trulicity and Bydureon. When it comes to evaluating the efficacy of Trulicity and Bydureon, it's important to consider the results of clinical trials and real-world evidence. Clinical trials provide valuable insights into the effectiveness of these medications under controlled conditions, while real-world evidence offers a glimpse into their performance in everyday clinical practice. In clinical trials, Trulicity has consistently demonstrated its ability to lower A1C levels and improve glycemic control. In a 26-week study involving over 4,000 patients with type 2 diabetes, Trulicity reduced A1C levels by an average of 1.6% compared to placebo. Furthermore, a study comparing Trulicity to insulin glargine, a long-acting insulin, found that Trulicity was non-inferior in terms of A1C reduction. Similarly, Bydureon has shown significant efficacy in clinical trials. In a 26-week study involving over 1,200 participants, Bydureon reduced A1C levels by an average of 1.4% compared to placebo. Another study comparing Bydureon to insulin glargine found that Bydureon was non-inferior in reducing A1C levels. Real-world evidence supports the findings from clinical trials, with many individuals experiencing improvements in glycemic control and weight loss with both Trulicity and Bydureon. However, it's important to note that individual responses may vary, and the effectiveness of these medications can be influenced by factors such as adherence to treatment and concurrent medications, safety and side effects, potential risks, and adverse events. As with any medication, Trulicity and Bydureon carry a risk of side effects. It's essential to understand the potential risks and adverse events associated with these medications to make an informed decision about their use. Common side effects of Trulicity include nausea, diarrhea, vomiting, and decreased appetite. These side effects are generally mild and tend to improve over time. However, in some cases, more severe gastrointestinal side effects such as pancreatitis may occur. Pancreatitis is a rare but serious condition that requires immediate medical attention. Bydureon also has its share of potential side effects, including nausea, diarrhea, and injection site reactions. These side effects are usually mild and resolve on their own. However, like Trulicity, there is a risk of pancreatitis with Bydureon, although it is rare. Both Trulicity and Bydureon have been associated with an increased risk of thyroid tumors in animal studies. However, it is important to note that the relevance of these findings to humans is still unclear, and further studies are needed to establish a definitive link. Choosing the right treatment factors to consider when deciding between Trulicity and Bydureon. When selecting between Trulicity and Bydureon, several factors should be taken into consideration. These include the frequency of injections, dosing convenience, individual treatment goals, and preferences. Trulicity offers the advantage of once-weekly dosing, providing convenience for individuals who prefer fewer injections. The self-administration aspect of Trulicity also empowers patients to take control of their treatment. However, some individuals may find the injection process challenging or uncomfortable. Bydureon also offers the convenience of once-weekly dosing, but its administration requires reconstitution and preparation of the medication. This may be a drawback for individuals who prefer a simpler injection process. However, Bydureon's sustained-release formulation ensures continuous blood sugar control, which may be appealing to some patients. Individual treatment goals and preferences are also important considerations. Trulicity's additional benefit of promoting weight loss may be advantageous for individuals with obesity or those seeking to shed excess pounds. Bydureon, on the other hand, may be preferred by individuals who prioritize sustained blood sugar control and do not mind the additional steps involved in its administration. Cost and insurance coverage. The financial aspects of each medication. The cost of Trulicity and Bydureon is an important factor to consider, as it can vary depending on factors such as insurance coverage, pharmacy discounts, and patient assistance programs. Both medications are brand-name drugs and may have higher out-of-pocket costs compared to generic alternatives. Insurance coverage plays a significant role in determining the affordability of Trulicity and Bydureon. Some insurance plans may cover one medication more favorably than the other, making it essential to check with your insurance provider regarding coverage details. Pharmaceutical manufacturers often offer savings programs and patient assistance programs to help alleviate the financial burden of these medications. These programs may provide discounts, coupons, or even free medication for eligible individuals. It's worth exploring these options to determine if cost assistance is available. Patient experiences. Real-life stories and testimonials. Real-life experiences can provide valuable insights into the day-to-day use of Trulicity and Bydureon. Hearing from individuals who have first-hand experience with these medications can help paint a clearer picture of their efficacy, side effects, and overall satisfaction. Many patients report positive experiences with both Trulicity and Bydureon, noting improvements in blood sugar control, weight loss, and overall well-being. Some individuals appreciate the convenience of once-weekly dosing, while others find the side effects manageable and outweighed by the benefits. It's important to remember that experiences can vary from person to person, and what works for one individual may not work for another. Consulting with a healthcare professional is crucial to assess individual needs and determine the most suitable treatment option. Consultation with a healthcare professional. The importance of seeking medical advice. When considering Trulicity or Bydureon for the management of type 2 diabetes, it is essential to consult with a healthcare professional. These medications require a prescription, and a healthcare professional can assess your medical history, current medications, and individual needs to determine the most appropriate treatment plan. A healthcare professional can provide guidance on dosing, potential side effects, and the overall suitability of Trulicity or Bydureon for your specific situation. They can also address any concerns or questions you may have, ensuring that you make an informed decision about your treatment. Conclusion: making an informed decision for glycemic stability. Trulicity and Bydureon are both effective medications for achieving glycemic stability in individuals with type 2 diabetes. They offer once-weekly dosing and have demonstrated efficacy in reducing A1C levels and improving blood sugar control. However, they differ in their mechanisms of action, side effect profiles, and individual preferences. When considering Trulicity or Bydureon, it's important to evaluate factors such as dosing convenience, treatment goals, potential side effects, and cost. Consulting with a healthcare professional is crucial to assess your specific needs and determine the most suitable option. Remember that individual responses to medication can vary, and what works for one person may not work for another. By considering the available evidence, real-world experiences, and seeking guidance from a healthcare professional, you can make an informed decision that aligns with your goals and preferences, ultimately leading to glycemic stability and an enhanced quality of life.